Welcome, everybody. We'll get going in just a little bit. Thanks for joining us today. I think it's a good time to go. Maybe others will join us in just a little bit. But before I start, I want to personally thank everyone. You've been so supportive over the years. You've helped us build a brand new state-of-the-art hospital and a nearly completed community care center at the Ojai campus. We're so grateful, and never have we needed these buildings more than we do right now. Just a brief update on the community care center. It's done. I walked it yesterday. All the furniture's in. The generator has been installed and tested. We're just working with some refinements right now. And later on this month, we plan to have our inspections, and possibly in the middle of June. Our target date is June 12th, when we're actually going to be open and move in. It's very, very exciting. This is a new format for us. We'd rather be together personally, but I think it's something that you're all used to, either with Microsoft Teams or Zoom or WebEx. It's how we're communicating these days, and we hope that the format works for you. I'd like to remind everybody to put themselves on mute. We're still trying to work some of the bugs out of the system, and there's a feature if you're on a computer, where you'll be able to ask questions, and I will be able to read those questions as we get through the most of the program, and be able to answer those toward the end. So in the meantime, I'm just going to cover 5 topics. I'm going to talk about COVID, federally, state perspective, what's happening here in Ventura County, the impact that it has on our health system and other health systems, discuss how we're reopening in a responsible manner. I'm going to spend a lot of time talking about how to ensure the public that we are safe and that we have a clean environment, and all the things we're doing with that. And then finally, I'm going to ask you to be ambassadors for us and to give us your full support. So let me start by talking about the financial impact. In California and throughout the United States, we agreed early on that we had a responsibility to society. And that responsibility was to keep everybody safe and be able to have enough resources to respond to community needs. One of those elements was that we voluntarily suspended all elective procedures, surgeries, cath labs, endoscopy lab, and so forth. And so our revenue and the revenue of most California hospitals went down as much as 40%. Our expenses did not go down. We had to retain most of our staff. In fact, we had to increase staffing to do things like screening at the doors and to make sure that we had adequate resources in our purchasing area. And while staffing flexed down a little bit with lowered census, it was not commensurate with the reduction of revenue. And so the result of that has been that our census has been down. Of course, with elective procedures, census has been down, but also a new phenomenon came in, and that was people were afraid of coming to the hospital for fear that they might contract COVID. And we've seen a lot of care being delayed. Volume is down across the board throughout California. Emergency room volume is down. Just one little short anecdote. About 2 weeks ago, 10:30 at night, my wife received a phone call from a friend who had a neighbor. The neighbor was in her late 70s, early 80s, and had a serious health problem. She called her neighbor wondering what to do. She did not want to come to CMH for fear that she might get COVID, but ironically, she would have stayed home and possibly suffered a significant illness or even death had she not come in. Gratefully, her neighbor talked her into coming in the middle of the night to receive the care she received. Our emergency room volume is down, but the acuity, the severity of illness is up. And while we have had now 24 deaths in the county associated with COVID, I fear that when the statistics are finally tallied, we'll find that there were also unnecessary deaths for people who did not seek care when they should have, and that's a sad thing. So I'm going to emphasize that it's a safe environment. But getting back to our financials, revenue down by about 40%. We lost $6 million, $6.5 million in March at CMH. Ojai lost about $1 million, which is not unusual for Ojai, but we delayed all elective procedures. We did not do any surgeries in Ojai. But in April, our losses were diminished a little bit. We lost $2.5 million. And this is because we have received about $12 million now with federal stimulus money. So the loss of $6.5 million or the loss of $2.5 million would have been significantly higher had we not received the stimulus money. And let me just refer to that briefly. We have received now $12 million from the federal government, and we expect to receive about that same amount in the near future, and hopefully that will balance things out. Cash flow wise, we're fine because we have enough money in the bank that we're able to weather this type of storm. And we've also received advance payments from the Medicare program. They advance us 6 months worth of payments. In April, Ojai actually made $2.5 million. And the reason is we got a $3.6 million stimulus check, particularly earmarked for rural hospitals. So I think we're going to be fine. We will not have a good financial year in 2020. But we'll have enough money to pay for all of our debt. Our bond covenants will be kept. And we're still going to be approaching the federal government and the state government for more funds. I'm the chairman of the California Hospital Association, and we've had good meetings with the governor's office and with representatives, both of the senators and the members of the House of Representatives of Congress. And they're very supportive. We as a healthcare industry are not trying to gouge society, but we want to remain afloat so we can take care of the needs. If you have questions about the financials, I'm very happy to talk about that. I now want to go back and to the next topic, and that is reopening services. Beginning Monday, this past Monday, we started to do elective procedures selectively. And we know there's a huge backlog of patients that desire to have surgery, but we are specifically screening patients who are well enough to be able to go home after surgery, whether they need to stay in the hospital for a couple of days or not. That's not the point, but we don't want patients to have to go to a skilled nursing facility following a major surgery. So we're screening patients, so we're not quite back up to normal, but nearly normal, about 80% of normal at this present time, and that is helping us out. And we are testing all patients before they come. We are testing patients within 3 days of their surgical procedure, and we have a whole system where they drive up and they get testing right in their car, or some can get out of the car and have the testing done, and then the results are back in. Patients like that. They want to be tested for COVID, and our staff likes it because then they can relax and know that somebody has been tested and they're negative for COVID. Let me just turn briefly to what's happening nationwide. I'm going to share a screen here that I hope you can see. Let's start with the national perspective. So this is a little bit of a morbid way of looking at our statistics, but we look at daily deaths in the United States. You can see that we had a big increase beginning in the middle part of March that continued, and then it peaked around April 16th. And while it hasn't gone down significantly, in fact, we have a little teeny blip back up, we're not continuing to accelerate as other countries had. This curve, the steepness of this curve is a little bit better than other countries. Let me just show you Italy as an example. With Italy, you can see a much, when it comes up, bear with me just a second. So Italy had a much steeper curve than ours, but now they're gradually going down, and we're about a month or maybe 6 weeks behind Italy. In California, we're doing okay. Let me show you New York first of all. Many people have criticized the, here's New York, a very, very steep curve, looks just like Italy. And they're coming down now with their deaths. California, you'll see a little bit different. In California, the number of deaths per day is much flatter. Do you see this? But when you flatten the curve, you lengthen the curve. And this is where we are right now in California. We've kind of plateaued. And the number of patients that test positive, the number of deaths per day are not going down as quickly as you saw with Italy or New York. They're staying about the same, which means that we're going to continue dealing with COVID for the next many months. But the good news is flattening a curve, you reduce the total number of patients that contract COVID, and of course the total number of patients that die. For Ventura County, we had 25 new cases since yesterday. We're now at 725, and we've had 24 deaths. Unfortunately, 477 patients have completely recovered, and so we're at least at this plateau. Again, we're not at the point where we can declare victory by any means. We're still dealing with this on a daily basis. So let me come back to what we're doing at CMH and at Ojai. At CMH, we started surgical procedures. At Ojai, we started on Tuesday with our first total knee replacement surgeries. And we want to emphasize this is not the time to put off care. We are clean. Our environment is clean. Our facilities are very, very clean. And let me just emphasize that a little bit more. We have separate pathways for anyone who comes to our emergency department with any symptoms. If they have symptoms, cold-like symptoms, flu-like symptoms, COVID-like symptoms, we actually have them go around to the back of our emergency department, and we have tents set up so they're sequestered. Our staff are completely protected with face shields, N95 masks. We ask the patient to put on a mask except when they're tested, and we do a screening and a testing from them. If they're ill enough, if they're well enough to go home, we send them home. If they're not well enough, we have them go in their car. We have spaces for the cars to park right behind our emergency department. They're then admitted, but they come into the building in a completely separate entrance from everyone else who does not have these cold-like or flu-like symptoms. We've done extensive testing for all of our patients, how to keep themselves safe and how to keep patients safe while on duty. All of our employees, all physicians, anybody comes in the building, they're screened for symptoms and they have their temperature checked before they're allowed admittance. Our employees are given a piece of paper today. It's a yellow piece of paper signifying that they have been screened. My temperature this morning was 97.9, so I was allowed in after the screening. Except for emergencies, we test all surgical patients for COVID. We adhere to very strict guidelines on this, and we isolate patients who have any symptoms. Today, we have 0 patients in that are COVID positive at Ojai, and we have 4 at CMH, and we have 14 patients that have exhibited symptoms at CMH, none in Ojai. So all those 14 of the positive patients are sequestered in a particular unit. They're required to wear a mask as well, and they're completely isolated and separated from all other patients. We also have patients in negative pressure rooms so that our staff, the hallways and so forth are not affected. No air leaves the room into the hallway. The air is all goes outside of the building. And we have excellent filtration systems as well. We have very strict rules, restrictions on visitors. We allow essential companions to come into the hospital. A father of a laboring mother, as example, the parents of a pediatric patient. We also allow in family members during a surgery, but we discourage them, and we've connected them electronically through FaceTime and other means. To ensure that our rooms are clean, our staff are extremely well trained, but we have equipment called luminometer. A luminometer tests a room after it's cleaned for any biomatter, any organic residue, where a virus or bacteria may have stayed after the cleaning process. And it shows up much like a black light can show a different material. And our staff are able therefore to clean it more thoroughly. But we really take this very seriously. Our rooms, our hospital, our hallways are constantly cleaned. You would be safer in the hospital than you would be at a grocery store or Home Depot. It is very, very clean. Our laundry services have been recognized as the first ever on-premise laundry to earn the national recognition of a hygienically clean laundry certification. And again, our surfaces are cleaned over and over again. Our food production is held to the very highest standards of cleanliness. And in short, I'm belaboring this, it's safe to come to our hospitals. It is not safe for patients to remain home or people to remain home where they may have serious illness or serious symptoms and not come to the hospital. And so I want to assure you. So before I get to your questions, I'm just going to, again, personally thank you for all you've done. You've helped us build wonderful facilities. We cannot carry on our mission without you. You have donated, or your friends in the community have donated 125,000 pieces of protective equipment for our staff. We want to thank you for that. Your generosity is felt, and we hope that you will continue to support Community Memorial Hospital. We rely on your generosity. And I'm also going to ask you to be ambassadors for our health system. Inform your neighbors, your friends, your family members, a little bit of what I conveyed, that we're safe, that we're doing well, that we're financially, we're going to be strong, but we still need your support. So with that, I just want to hope that everybody is safe and remains well during this very unprecedented time. We haven't been here since the Spanish flu in 1918. So I'm now going to go to some of your questions. I see a couple there. We thank somebody gave us a shout out that we're doing a great job. Our teams are amazing. Thank you. I round a lot every day, weekends included, and we have amazing staff. I agree with that. So thank you for that. The next question is, will any of the stimulus money need to be repaid? No is the answer. However, we expect to have audits. So when we receive money from the federal government or the state government, but in this case, the stimulus money is federal, we need to account for every penny, that it was appropriately used, that it was to overcome and augment our losses so that we were able to provide care. So we've hired our auditors, Ernst & Young, and they are making sure that any penny that comes in, that we're able to appropriately account for it. There are three opportunities for hospitals. One is stimulus money, which is a grant, it's not a loan. The second one is the payroll tax of $5,000 per employee. We're not going to take advantage of that because, number one, And number three, there are FEMA dollars where we could get reimbursed for some of the emergency things we've done. For example, all the PPE we bought an ultraviolet robot to clean our operating rooms and our other rooms afterward. We have bought testing equipment. All this thing could have been accounted for with FEMA, but the federal government says you cannot double dip. So it's either stimulus or payroll tax or FEMA, but you can't declare the same loss and get reimbursed for all three things. So Ernst & Young is helping us with that. And let's see now, that was the same question. Two of you had that same question. So that's great. Let me just go down to the next one. How many COVID patients has CMH seen? About 24, 25 now. Having said that, there are a number of patients, maybe 3 or 4 times that number actually, who have come through our hospitals that we believe had COVID, but they tested negative, or maybe in rare cases were not tested at all. And the reason for this is there is a large number of patients that where there's what we call a false negative. And part of that is the fact that the testing is done with a swab that goes through the nasal cavity into the back of the throat, and it has to, the swab has to be spun for about 5 seconds. Viruses, unlike bacteria, are not on the surface of the tissue. They're embedded in the cells themselves. So if that sampling is such that we don't get a good quantity of viruses, we can end up with a false negative test. So I would guess there have been approximately, this is only a guess, about 100 individuals that have come to our hospitals that did in fact were exposed. 25, 23, 25 actually tested positive. Next question, it's been reported in the news that several physicians and one administrator tested positive for COVID. Have any employees tested positive? If so, how many? So we had 3 anesthesiologists and 1 administrator that did test positive, and they were quarantined and they were out of work. Anybody exposed to them during their time at the hospital were also self-isolated. I was one of those. I did not have COVID, but we had to self-isolate ourselves from our family members and so forth, and for everybody here at the hospital. And we have had additional members of our hospital team test positive for COVID. We've had 2 other employees, and I think a third now, whose family members got COVID and exposed them in the home. We're unaware of any patients or any other staff members who were exposed and tested positive after being exposed to any of the 4 I mentioned. But we did have a nurse who tested positive after her husband tested positive, who also worked in the healthcare field, not with our health system. And a food service worker at one of our facilities tested positive, developed symptoms. He did not come to work, and he tested positive. And there may have been one other at one of our outpatient clinics whose family member tested positive. So altogether, if I'm counting the arithmetic, I think that's a total of 8 individuals. And our infection prevention team does this amazing job of interviewing them and finding out retracing all their steps. And we have computer systems that allow us to see any patients that were involved, any staff members, other physicians that were, and it takes a lot of effort, but ultimately we get to all those that were exposed, and unfortunately we have to have them self-isolate. They're not allowed to come to work. We pay our employees during that time, and when they pass the incubation period, then we welcome them back to the hospital. But this is an abundance of caution so that we don't have people expose others as we go. Other questions, What are CMH's projections regarding a second wave of the virus? When does CMH anticipate that it will hit? What are the projected numbers of infections in the area? And what precautions is CMH making now in preparations for it? This is really a good question. As I said earlier, I'm the chairman of the California Hospital Association, and on Monday we held a meeting. I called a meeting, and one of the agenda items with our executive committee, which is about 25 senior executives of the major health systems in California, the first agenda item was resurgence. If we were in New York, we wouldn't worry about a resurgence as much as California, because we've done a much better job in flattening the curve. But we're witnessing communities, particularly some of our rural areas, that want to reopen the economy, or in other words, they want to open up businesses, they want to be able to gather again for weddings and other occasions. They want to return to normalcy. Well, we understand that that worries us, because that's where social distancing is forgotten, and people can get too close, and asymptomatic people can pass COVID on to others in an unsuspecting manner. We've already seen some resurgence happen. Examples of it are in San Diego during the seasonal harvest, where many farm workers have crossed the border and have been exposed, or they have brought it with them, and San Diego had a spike. Their numbers had gone up. So we might be saying an unpopular theme of wanting to continue social distancing. We realize that this is hurtful. It is hurtful for small businesses. It is hurtful for large businesses. It is constraining freedoms that we hold dear. But we have seen what's happened in other countries. We've seen what happens in other states, and California will not have this rise and fall as we've seen in other areas. It's flatter. It's going to be more like some rolling hills. One forecast is that we'll be dealing with a modest amount of positives, and unfortunately a controlled number of deaths between now and the end of the year. And so we have to be vigilant. And as we're vigilant, we have to open up the hospital for elective cases and be able to do it. So here's our plan. As much as we can, we're going to use our existing facilities, but we're prepared to open up the old Mountain Tower, and as a place where we can have a spillover if there is a resurgence. Or if we're not able to have patients that have tested positive for COVID, or patients who have symptoms, and skilled nursing facilities cannot accept them. It might be an extended care facility. It might be an observation facility in the old Mountain Tower, and we'd have sufficient beds to be able to do that. If we don't do something like that, then we run the risk of being able to have our hospital closed. Next question is, are COVID tests readily available? What time are you experiencing in getting test results back? These are really good questions. I wish I had written some of these. We can test all preoperative patients. We do a daily run to a commercial lab that we have a contract with, and the test results come back between 48 hours and 72 hours. We do have in-house capability where we can get test results back in as little as 45 minutes, but the test kits are limited. In fact, they're so limited that we can only approve a handful of these a day. Our allotment is about 240 test kits per month, and until that increases, we have to limit that supply. So in short, we have enough testing capability for all patients, but the turnaround time is so long that we're only doing it for preoperative or pre-procedure patients. So what are we doing about this? We're trying to purchase another piece of equipment, a Roche platform, where we'd be able to do rapid testing less expensively than we're doing right now, immediate, and that equipment is not yet available. We have a purchase order for it, and there's a backlog of these machines. Next question, are there estimates of deaths in the county attributed to COVID, the fear factor, delayed treatment, and getting this information out may help convince the fearful patients. We brought this up with the county health department, and it's a difficult thing to track because we've had here, this is anecdotal, but we've had young 50-year-old people come in too late with symptoms of a heart attack, and we've lost 2 individuals that come readily to mind. I think if those individuals had come in earlier, their lives would have been saved. How many? It's only an estimate, but I would guess that we have 24 deaths due to COVID. I would say at least that number of people have died because of delayed care. Do I know that for actually? No. But we do know that other hospitals have experienced the same thing. And it's enough of a concern that we mention it as a group of hospitals to the county health department. Do we know what % of people have tested positive are asymptomatic with mild symptoms? That's also a great question. The answer is no, and this is why we as a community, actually throughout the nation, have not had enough tests to test everyone. Asymptomatic patients that want to be tested out of curiosity are turned away. Even though we have more testing capability, we're still only doing testing on those patients that are symptomatic of cold-like or flu-like symptoms, or it's known that they have been in the presence for a prolonged period of time without protective masks, a family member, a coworker, and so forth. They can also be tested. So we don't have a good feel for this. There are estimates, however, from other countries, and I can't verify these numbers, but other countries have estimated that those that have been exposed to the virus, as many as 80% are asymptomatic, or they have symptoms that are not characteristic of the classic COVID symptoms of a severe dry cough, of malaise, of body aches, loss of sense of taste or smell, fever, and so forth. Some people might have one of those. They may feel a little bit odd. They may feel tired, and they could have been exposed to the virus. Antibody testing will ultimately be available. Right now, antibody testing is undergoing scrutiny by the federal government. It may work, it may not work. There could be some false positives and negatives. So eventually that's going to be worked out. And what we really hope for is of course, the vaccine. To have the ability of vaccinating patients, inoculating them with the disease. So that's the status of that. I don't know if I have answered other questions. Let me just see if there's other questions that you might have. We're running up on about 35 minutes. We intended this to be about 40 minutes. I was just handed some additional questions that were that might be of interest to you. How is CMHS handling the national shortage of testing capabilities? I think we talked about that a little bit. We're trying to get our own equipment. We have our own equipment in-house, but limited testing kits, and we're contracted with large national laboratories at the outside. Maybe in a month we'll have the ability of testing with unlimited supply. Do you have enough supplies, specifically personal protective equipment? Yes, we've been very fortunate. We had to be very inventive and had to buy some of the PPE outside our normal supply chains. We bought 250,000 masks, like the one that we wear like this, so that we require everybody. I'm not wearing it because I'm in my office alone, but we require all staff members and physicians to wear these. We bought 250,000 of these from Belgium. And so that was the supplier that we had, but gratefully we have enough PPE right now. I've heard the old ED is ready to take patients. That's true. We have converted our old emergency room into a holding area in case there is a surge of COVID patients. We've set up beds, monitors, computers. We're ready to go with equipment and supplies the moment we need it, and we hope we won't need it. Our old ICU is set up now with beds and computers and monitors. We could begin seeing patients there. And as I said, the 6th floor of the old building, we may set up as a extended care facility should we need that in the future. If we run out of beds in the Ocean Tower, we'll be able to open the Mountain Tower. I think I just addressed that. What does it look like? I think I addressed that. What do we do in Ojai? Ojai is doing really well. We have enough beds right now, but we really want to move into our new continuing care center, which gives us state-of-the-art facilities and 15 additional beds that we don't have right now. And so, as I said, we'll be moving in sometime in June, and that will help us. If there is a surge, we've already started discussions with the city of Ojai to allow us to continue to use the old continuing care center if we need to use that facility, and they're agreeable to that. Let's see here. Should we be concerned about staff and physicians return to work after a positive COVID diagnosis? The answer is no. Before coming back to work, they have to be off work for at least 14 days, and then coming back to work, they're tested and verified that they no longer have the virus in their system they could share with others. Can we recover financially from this event? I hope so. I believe so. I've had personal conversations with elected officials at both the federal and the state level in my role as CHH chair, and they're very supportive. We're going to get through this very unprecedented time. And then let's see, any promising news about the vaccine? I know about as much as you do about that. I understand between 8 and 10 companies have now been approved to take further steps in research. About 50 companies have been denied. So these 8 or 10 are the most promising, and they are typically large companies that are experienced in this and have all the science along with some of the universities. And hopefully we'll have a vaccine, but the vaccine will probably not be available until well after the end of the year. When will primary care physician specialists open up their offices? Some are already open, many are already open, but many physicians are doing virtual visits. Our Centers of Family Health, for example, we see typically 1,000 patients a day on a typical day, and recently we've been seeing half that number with, just like we're talking right now, with a video chat with the patient, and the prescription is refilled after the physician speaks to the patient, either by phone or typically in a video chat, and that's the method used right now. But primary care physicians have been incredible, not only in our system, but throughout. Most are relying on a virtual visit instead of an in-place visit. A couple more questions. There was a thanks for the update, and then have you had COVID positive patients in the CCC? No, gratefully no. We did have one patient that had suspicious symptoms, had to come to the acute care hospital. This is about 3 or 4 weeks ago, and is now completely well. The patient may have had a flu bug, but they did not test positive for COVID. We were very, very sure of that before the patient returned. Most of the cases from skilled nurse facilities have occurred in Simi Valley and Thousand Oaks. For some reason, the East County has been afflicted with COVID far more, almost a 2/3, 1/3 issue. In fact, Ventura has had only 46 out of 725 patients that have tested positive. Ojai has had 6 and Oakview has had 2. Whereas Camarillo has had 54, Oxnard 184, Simi Valley 184, Thousand Oaks 102. So very much disproportionate to the east side of the county. Those are all of our questions right now. Actually, one more came in. Has it been proven that wearing a mask in public is helpful? I think it's helpful in a couple of areas. The first one is if I wear this mask, as I'm wearing right now, if I were to sneeze or whatever, it would prevent largely contaminated viruses or bacteria from escaping my person to someone else. COVID is not airborne; it's more of a droplet. So not to be too graphic, but it'd be a droplet of the moisture that I expel out. And if that came in contact with somebody's mouth or nose or eyes, they could contract it. So it does help in that. But the bigger thing is I am conscious that I have a mask on, and I'm not going to be touching my face. My hands will pick up naturally bacteria and viruses as I touch surfaces like my desk or doorknobs or pens and so forth, and I'm not touching my face. So it helps the person wearing the mask to avoid contact with the mucous membranes, and it avoids my expelling whatever germs I might have to someone else. So yes, it has been proven to be effective. Cloth masks have not been, are not as effective according to CDC as the manufactured paper masks are, because they have two factors. They can get moisture, and secondly, the filter of the fibers, the fiber openings are much greater than the kind of mask that I am wearing right now. An N95 mask has a tighter filtration than what I'm wearing, which we call an aseptic mask. And so masks are a good idea, and we encourage people to wear them in public. So with that, I hope that this has been helpful. I don't see more questions on the screen. We'll wait a minute or so, but really, I just want to thank everybody for your support. This is a very unusual time. It's cliche now to say unprecedented. I've never experienced anything like this, and nor have you in our lifetimes. We'll get through this and we'll be fine. Hospital or health system is going to be fine financially. Patients are going to get well, most of them, of course. So let's all do what we can to avoid the spread of the disease and stay well. So with that, I'll end the call unless there's any other questions you might have through the chat box here. I don't see any, so I will I'll go ahead and end the call, and thank you so much for your time. Thank you. Bye-bye.